The Mid-South, like so many other places in the U.S. right now, is battling the triple-demic outbreaks of the flu, RSV, and COVID. Right now, there are medical shortages that could make it difficult to manage infection and disease. Joining us now to talk about which drugs are in short supply and how it could impact patient care is infectious disease expert Dr. Steve Threlkeld with Baptist Memorial Health. Good afternoon, sir. Good to see you.
Hey, Joyce. Nice to see you.
All right, reports show that flu antivirals are already in high demand right now, and now pharmacies are struggling to keep things like Tamiflu on the shelves. Can you talk about what kind of impact a potential shortage could have on our community?
Well, it's kind of coming together in a bad way. It's an early peak this year. We saw that in Australia. We're seeing it backed up here. I got to experience it as a parent a couple of weeks ago when one of my kids got a fairly severe case of flu in another city. It took all of my efforts for 24 hours to get the drug for her, and that's a problem because the clock ticks. You really need these medicines in people within 48 hours of the onset of symptoms for maximal effect. So there is indeed a practical shortage, though there hadn't been a lot of official talk about it. It takes some phone calls to find the drug at times. We have to think things like trying the liquid version or maybe even some alternatives in some particularly kids to be able to treat them.
What do people do if they can't find antiviral medication?
I think you get your doctor to look at alternatives. There are 4 approved anti-influenza medications out there. And so it may be that one of the alternatives, there's something called Paramivir, there's Zanamivir, there's Zofluza, a new one-time pill. So there are some options, and it may be that a given pharmacy or city may have better stocks than another. But unfortunately, the wholesalers are low right now. They didn't anticipate somehow the demand, and the demand is going up very quickly right now because the flu is going up sooner than almost ever in recent years it has done.
Okay, there is also, I'm reading here, a reported shortage of amoxicillin. Talk to us about what that antibiotic is and how dangerous a shortage of that medicine would be.
You know, it's interesting. I mean, unfortunately, there's a lot of unnecessary antibiotic use out there. So it's probably not quite as big of a problem as the antivirals because there almost always are good options. If we're out of amoxicillin, it's used to treat strep throats and other important things. Don't get me wrong, but there are usually adequate options for physicians available to give as alternatives if amoxicillin is low.
Okay, final thoughts. We have about 15 seconds left. Anything else you want to add?
Well, I mean, the big thing is get your flu vaccine. Avoid it altogether, or at least avoid the worst forms of it that you really need the Tamiflu and other medications for. That's really the answer to this, to be sure.
All right. Thank you for taking time out of your busy schedule. As always, Dr. Threlkeld, good to talk to you.
Thanks, Joyce.
Thank you, sir.